Thank you, Madam Chair, and thank you also to Mr. Courtney for introducing this important bipartisan legislation. My amendment to H.R. 1309 is a clarifying amendment to ensure that nothing in this act shall be construed to limit or diminish any existing protections in relevant federal, state, or local law related to domestic violence, stalking, dating violence, or sexual assault. According to a 2016 OSHA report, approximately 75% of the nearly 25,000 workplace assaults reported each year occur in healthcare and social service settings. And workers in healthcare settings are 4 times more likely to be assaulted at work than workers in other sectors. These cases have led to psychological trauma, not only for the victim, but also for those who have witnessed these attacks, as well as serious injury and even death. With workplace violence on the rise, it is vital that Congress address this issue to ensure the safety of workers, and that's why this bill is so important. While most incidents of workplace violence fit the definition of simple assault, a study by the Joint Commission shows that sexual assault, rape, and stalking are not uncommon. Approximately 38 states include rape, sexual assault, and stalking in their definition of domestic violence. My amendment makes it clear that nothing in the underlying legislation preempts or diminishes these protections in any way. According to the Bureau of Labor Statistics, less than 30% of U.S. workplaces have a formal program or policy that addresses workplace violence, and 7 out of 10 workplaces do not have formal domestic violence program or policy. That means that more than 70% of U.S. workplaces have inadequate protections against workplace violence. Inova Health Systems, one of the major healthcare providers in Northern Virginia, recently conducted a survey at their hospital in my district on the incidence and cost of nurse workplace violence perpetrated by hospital patients or patient visitors. The results showed that 75% of nurses experienced violence within the past year, with emergency nurses experiencing significantly greater number of incidents. Nurses reported many barriers to reporting these incidents, including unclear reporting policies, fear of retaliation, and the disheartening perception that violence just comes with the job. These statistics show that the current voluntary efforts to prevent workplace violence are not working. The results of the Inova survey highlight a real need for effective training and clear, convenient reporting programs and environments that support workers who are experiencing violence. This bill seeks to address this need. As a former domestic violence prosecutor, I have seen firsthand how laws protect and provide valuable resources to the more than 12 million individuals who are survivors of violence crimes. I offered this amendment to ensure that it is abundantly clear that workplace violence prevention plans developed under this bill complement existing legal protections against domestic violence and sexual assault, and in no way diminish or limit those protections. It's crucial that our laws at the state, federal, and local levels continue to help and support victims of domestic violence, stalking, dating violence, and a sexual assault, which is precisely what my amendment does. I urge my colleagues to support this amendment, and I reserve the balance of my time.